let's see, how many years ago? I guess it was 8 years ago. I knew I wasn't feeling too good. Things were, I was getting winded and couldn't do things I had done previously. So I went to see the cardiologist, and he did do a stress test. And it was sort of, well, maybe not, I don't know. And so he said, but I think we ought to do a catheterization just to be sure that, see where we are. And maybe we can do some angioplasty, and you'll be able to breathe a little easier and not get so winded. And when they did the catheterization, I just had too much blockage. He said, we're not looking at an emergency. You're not going to walk out of here and not come back. He said, we have time to schedule it. So we did. Within the next 2 weeks, we scheduled the bypass surgery, and that's how I ended up there. That was the first one. The second one was in 2011, and again, I just could tell I was not being able to do things, and we did a catheterization, and some of the bypasses had failed. Not the major one, thank goodness, but some of the others had failed. And so I had a big choice to make. Do we do this again, or do we try to treat it with medications? Dr. Hussein was very, upfront with me about doing it a second time. And he told me what the possibilities that were, and we knew that, that it might, these could fail again, and it doesn't mean that it's going to fix it forever. And we just came to the conclusion that given my age, it was a wise thing to go ahead and try to do the surgery a second time. I do like Dr. Hussein a lot. He's wonderful. The intensive care unit there is fantastic. There is someone with you, you can see them sitting right outside there. There's always someone right close to you, monitoring everything while you're in the cardiac intensive care unit. And the care there is fantastic. I have no complaints whatsoever. All the nurses and the aides that work up there were just wonderful. So they take good care of you, which you need at that point in time. But boy, do they push you to get you up out of that bed and sitting and walking, and you really don't want to. But they're real good about being sure you're doing all the things you should be doing. The hospital has a great program. They have the rehab program at the hospital, and you go after your surgery a month to 6 weeks, depending on you and your doctor. You can start in that program. And in that one, they monitor you completely. You have the monitors on, they monitor your heart, and the entire time you're exercising, they are monitoring your vital signs, your heart rate, your pulse, your not your blood sugar, but your heart rate and your blood pressure. And so I did that after the first one, and then started going to HealthPlex in the program that Cape Fear has out there, and have been very faithful in going Monday, Wednesday, and Friday every week as much as possible. I don't like to exercise. I'm going to be just very honest. I hate to exercise. If I were not in that program and expected to be there and have the camaraderie of the other patients and clients that are there, I wouldn't do it. I mean, days that I can't go for one reason or another, I don't exercise. I got to have the rigors of a program and people expecting me to be there and do things. The staff out there is tremendous. We love Mary and Meg. I mean, we all do. They're tremendous out there. It's just a good program overall. I have never chosen to go out of Fayetteville for medical care, and I don't think that I will be. The cancer center, I have been a patient there, and so it is. I got wonderful treatment there also. So I have no reason to think that I would ever leave Fayetteville and the medical facilities we have here. They just keep improving.